Hey, what YouTube? This is Pat. Said I was going to come back on complications. Reason for doing this is because I had gastric bypass, and I know some of our brothers, we're big men. So before you can have your SRS, I know most of the doctors like to see that you've lost weight to a successful outcome at the end. We need to lose weight. So, and then health-wise, I had high blood pressure, I had high cholesterol, I had fibromyalgia, so I have a lot of back pain. And with that weight loss, I was hoping that it would help me with that. And it has, in ways. Now, one of the main reasons I'm coming in here is because I know some of our brothers who maybe, there's some out there maybe contemplating getting gastric bypass or sleeve or whatever. And the thing is I was a little naive when I went to it. Doctors, they'll sit and they'll tell you the complications, but they don't tell you the extent of the complications that can go on. And I say that because I thought I was prepared and I knew what was going on. I knew what my doctor was going to do. So I was 100% ready. This is how it went. September 7th of last year, 2010, I went in and had my surgery. Now, from that surgery, I had to have a second surgery because after the surgery, I kept throwing up and I couldn't eat. I couldn't keep anything down. I was just a mess. So she had to go back in and see what was going on. They did CAT scan and they saw that my bowels were twisted and I had a hernia inside my bowel. So the first thing was a hernia. So that was this is surgery number 2. It was the hernia, to go in and fix the hernia. And then while she was in there, that's when she saw that the bowels were twisted. So she didn't fix it right away because she wasn't too sure about what was going on. So she went and asked her colleagues before she went back in me. That was surgery number 3. So she went back in and untwisted my bowels and got it full and right. And after that surgery, I developed a fistula. And like I was saying in the last video, a fistula is like this is my small bowel, and it leads right up to the skin, to the surface of the skin. And at the surface of the skin, you have a hole, and that hole goes all the way down. It's like a little goes through that tunnel and comes out of the bag. I think I can show you guys some of this bag. I don't want to show too much. And in it, it's a hole right in the dead center right there. And this is what I have to wear all the time until they can fix that hole in my stomach. And I know our brothers, there's some out there that are thinking about having a surgery. But the thing I wanted to say is look at all the complications that could happen. Just like I didn't know. So if I was educated then, like I'm educated now, I wouldn't have had the surgery. But not saying that all of them come out bad, because there's some gastric bypass that have come out wonderfully and looks good and people look good. But I just want to tell you some complications that the doctors don't tell you, such as the fistula, hernia, bowel twisting. So first was again I'm going through them, was my gastric bypass. Then I had the hernia. Then I had the twisted bowel, and I had a fistula with that twisted bowel. And the reason I got that is because she's gone in these 3 times, and after a while the bowel gets it's not as strong, so a hole just developed. So we let that close up on its own, and it was closing wonderfully. So I was in the hospital from September to December of that year. of last year. And I was able to get out a couple of days before Christmas and come home, spend Christmas with my family. But while I was in there between September and December, those 3 surgeries had happened. And the 4th surgery was an abscess. And an abscess is what is like an infection that is inside. So what had happened is that I like to do my own stuff. I was changing the dressing, and when I pulled the dressing back, it looked like all my skin, all my insides was coming out. So I put my hand over it real quick, and I was like screaming because I didn't know what was going on. And so I had to have emergency surgery for that. So that's surgery number 4 right now. And so that was the next surgery, and I'm still there. I'm in intensive care. They thought they lost me on the table. I had to be put on a ventilator to breathe for me while I was in surgery. All things I never knew could happen. They'll tell you, okay, this is going to happen, this is going to happen, but they don't give you an in-depth look at the different things that really could happen and how these things can kill you. I know there's been some that have lost their life having this surgery. When I was in the hospital, there were several other individuals in the hospital with some of the same complications that I had. So there are more complications. There's a larger community of complications than there is of no complications. And so this is more like an educational film, and just to fill you in on some of the things that can go wrong that the doctors don't really mention because they don't think it will really come up, but it has. And everything you can think of that could go wrong in a gastric bypass patient, I have had. Go figure. But as I was saying, I had the fistula, and then I had the abscess. So they had to go in and get all that infection out and try to close it up again. And they didn't close my skin up. They actually let it stay open and let it heal itself, close itself. And it worked. It was pretty good. I had on what was called a wound vac, and that wound vac would suck out anything that was wrong and kind of like pull the skin together. So you don't have to have stitches or anything like that. It automatically just goes back, and that healed well. So like I said, I got out in December, a couple of days before Christmas. I stayed out of the hospital for maybe 2 weeks, and then I got really sick again. I had to go right back in the hospital, believe it or not, and they had to take out my gallbladder. So that's surgery number 5. And surgery number 6 is what I just had a couple of weeks ago, where it didn't work. So surgery number 7 is, I have developed another hernia, but this time it's a type of hernia like your belly button hernia, and so it's a totally different type of hernia. So I've developed a hernia. The hole hasn't closed, and they're going to do a tummy tuck as well. So all these 3 things are going to be done on my next surgery, so everything should be clear up by then. So if there's any of you out there that really are thinking about having gastric bypass or gastric sleeve or other things that you may have, ask your doctor a lot of questions, because they're not going to tell you everything, every little thing that can go wrong, and everything that could go wrong went wrong with me. And so maybe this can help somebody when you're thinking about trying to lose weight. I mean, I exercise. I did all the things that I thought was good, to try to lose all this weight. You see some of my exercise videos. I tried to do the P90 eggs. I mean, I've done, you name it, I've tried it. Cut back, it's too much to talk about. But so I went and did it for my health reasons. I did it so I can have my SRS. I wouldn't have any complications going through that. And medical reasons, try to get rid of the high blood pressure, the high cholesterol, which it did get rid of those things. I don't have high blood pressure anymore. I don't have high cholesterol anymore. And, it's one thing I did forget. While I was in the hospital this last time when I got my gallbladder out, you see the kids in Ethiopia, you know how stomach is huge. Well, I learned that it is huge like that because they lack protein in their diet. And so while I was going in and out these surgeries, my protein started to deplete, and it was going down and down and down. And when that happened, my legs swelled so big that I could hardly stand up and walk. The nurses had to come and help me walk because my legs were so huge. And I mean, it was just like, it was pure fluid on it. And when you don't have that protein in your body, you can't get rid of this fluid. And I didn't know that, but now I do. And now some of you know. So, like I said, maybe this can help somebody, maybe not, or I just be just ranting and telling my story. But that's what happened, and I pray that it doesn't happen to anybody else, because I've been through this process for quite a while, and it's not nothing. It's not a tripping apart or anything. I wouldn't wish this on my worst enemy, because like I said, I almost lost my life twice through this. But what I'm saying is, just be real careful if you want to have gastric bypass or anything. Just be real careful. Talk to your doctors. Look at the different things that can go wrong. Let them really talk to you. Also, which I was totally against from the very beginning, throughout those surgeries, my red blood cells were getting low as well. So I had to have 2 pints of blood. And I'm the type of person that I didn't want nobody's blood. I wrote it on my thing, I'd rather die than give me blood. But of course I changed my mind, because I had to get 2 pints. And the thing that really changed my mind is I was out in the hall. They want the patients to get up and walk, and try to heal with the healing process. I was out walking, and I was up at the nurses station talking to the nurses, because they know me, like I'm part of the family. That I was part of the family. And I felt kind of funny. I said, well, I said I'm going to my room, because I feel a little lightheaded or something. I've never felt it in my life, so I didn't know what that feeling was. So I always said I was going to get me a little ice, and maybe that's what was wrong. I was just getting hot or whatever. So I walked in, and the last thing I remember was putting ice in a cup, and then the next minute I was on the floor. And that was because my blood pressure had dropped so low that it couldn't function. My body couldn't function because of the low RBCs in my body, within my body. So after that, I said, okay, I'll take the blood transfusion and try to get that back up quickly. And I gotta think of other things, like my kids, my wife. I don't want to leave them with this mess, and my mistakes for having the surgery. But it was for all good reasons. But if I've known then what I know now, I've never had it. I just have to try to find a different way of doing things, which I've learned after the fact. But I wish I knew beforehand. So, but it's done now, and there's nothing I can do about it. But just to try to stay healthy as much as I can now, and abide by the things that they tell me to do. As a matter of fact, I'm feeding myself now. See? This way. See that? It's hooked up. This is my vitamins and stuff that comes to my tube. And this tube here, this one here, is going to my vein. So it goes right into my vein. And my stuff I have is in like a little backpack they give you. And my feed stuff is inside here. And it's got a battery operated machine that feeds me. I stay on this for 10 hours a day, and so I kind of put it on about 9 o'clock, and it's done in the morning the next day. And so that works out pretty good. I don't have to, when I was in the hospital, I had to have it on 24/7. I couldn't take it off. But now, while I'm home, I'm able to stay on it for just 10 hours, and that was it. And that's it for each day. Now, so those are the things that happen to me when it comes to the gastric bypass. I lost 100 pounds. Like, I've lost my weight too fast, because